Hi, my name is Rachel Ivy, and this is my presentation on cultural factors and health disparities in minors who are parents or pregnant. In addition to increased risk of communicable diseases, complications like anemia and hypertensive pregnancy disorders, increased risks of self-harm or harm by others, pregnant teens face serious adverse health outcomes. These include being 3 times more likely to suffer from postpartum depression, a 60% higher infant mortality rate, giving birth prematurely with a higher risk of lower birth rate infants, and being more likely to give birth to a baby with congenital anomalies. So let's first look at cultural environment. Teenage pregnancy and motherhood has been portrayed by the media in shows like 16 and Pregnant, Teen Moms, and movies like Juno. These media portrayals can affect adolescent attitudes and outcomes. Research has suggested these shows decreased behavioral intention to avoid pregnancy. They felt a connection to the teen moms portrayed on TV. And another study stated that those who viewed 16 and Pregnant were less likely to perceive themselves at risk for pregnancy and more likely to believe that the benefits of teen pregnancy outweigh risks. These inaccuracies can place teens at a high risk for becoming pregnant. Teenage moms can experience unique health risks and poor health outcomes for their baby and themselves if they do not receive support from their family. Some ways that the family of a pregnant teen can be supportive is by helping the pregnant teen get regular prenatal care, find parenting classes, prioritizing school, supporting breastfeeding, and getting involved with childcare, and promoting positive parent-child relationships. Peer pressure has been found to significantly influence teenage pregnancy, but once pregnant, relationships with peers change. Studies have shown that pregnant teens have felt shame from peers, consequently impacting their motivation to go to school for fear of being mocked by their peers. Peer isolation is another common report. On the other hand, teen pregnancy support groups have helped teen moms feel hope, increased perseverance, and practice positive parenting. While there are still barriers to access health services and education to adolescents, laws and policies can promote and protect sexual health and preventing unintended pregnancy. Additionally, federal laws like the Title IX of the Education Amendments of 1972 prohibits discrimination on the basis of sex, including pregnancy and parental status, in educational programs and activities. In the U.S., all public and private schools, school districts, colleges, and universities receiving any federal funds must comply with Title IX to protect from discrimination, such as with school activities, medical leave, and harassment. Studies have shown that compared with young women with no family history of teenage births, young women whose sister had a teenage birth and those whose sister and mother both had a teenage birth were significantly more likely to experience a teenage pregnancy. Pregnancy prevention interventions targeting young women according to maternal and sibling teenage birth histories may be effective. Additionally, the CDC reports that children of teenage mothers are more likely to give birth as a teenager as well, thus continuing the cycle of teenage pregnancy. Cultural barriers include attitudes about the effects of sex education and resistance to sexual health services. These cultural barriers can greatly hinder access to informative education, contraception, and health services. This population also faces cultural shunning. Teen mothers from the UK, Canada, and the US give similar reports of stigmatization. The most common sources of stigma identified by mothers are media reports and strangers who glare at them or verbally rebuke them in public. Some teen moms have also felt shunned through rude behavior, heavy scrutiny, and mistreatment by social services and school staff, and being chastised and treated disrespectfully by clinicians. Unfortunately, teen mothers are well aware that they are considered unfit parents and respond to this stereotype and the fear that their children can be removed from them unjustly by carefully dressing their children in clothes they can hardly afford to appear respectable, They alter their attire for prenatal visits and avoid disciplining their children in public to avoid misinterpretation. Moving on to health disparities. Certain socioeconomic factors affecting communities and families can contribute to high teen birth rates. Some examples include low education and low income of a teen's family, racial segregation within neighborhoods, unsafe and unclean neighborhoods, and low-income neighborhood inequality. Additionally, teens and child welfare systems are at an increased risk of teen pregnancy and birth compared to other groups. Furthermore, there is a higher teenage pregnancy rate among Black and minority ethnic groups. These teens frequently have limited access to prenatal and postpartum health support. Religion plays a role in reduced teen pregnancies because those who grew up religious are less likely to be sexually active not only in their teens, but in early adulthood as well. However, among the teen pregnancy rates of religious teens, abortion rates are significantly reduced, resulting in an increase of teen parents. Additionally, gender can affect the outcomes of teen parenthood. For males, they are more likely to face economic and employment challenges and are more economically disadvantaged than adult fathers. They have a lack of teen parent programs for help, and they are less likely to finish high school compared to their peers. For pregnant teen females, more than 50% of teen mothers never graduate from high school. About 25% of teen moms have a second child within 24 months of their first baby, and less than 2% of teen moms earn a college degree by age 30. Now, on a worldwide level, almost 1 in 6 teens become pregnant. Almost 1 in 6 is a lot. The lowest teen birth rates are countries in Europe and North America, and the highest rates are in countries in sub-Saharan Africa. Although adolescent birth rates have generally decreased globally, with the exception of East Asia and the Pacific and the Middle East and North Africa. On a nationwide level, teen birth rates are higher in the South and Southwest regions of the U.S. CDC reports that between 2007 and 2015, the highest birth rates occurred in rural counties. Lastly, teen mothers are stigmatized by stereotypes that they are unmotivated, irresponsible, and incompetent parents. These implicit biases impede effective clinical care and contribute to teen mothers' many challenges. Even though discrimination against pregnant teen students is illegal, it still occurs. Sometimes even the most subtle forms of discrimination can be enough to push pregnant teens out of school. Some examples of these explicit biases that pregnant teens face in school are the refusal of excused absences for prenatal care, teachers not allowing makeup work, and pregnant students feeling coerced into attending an alternative school. So that is it for cultural environment and health disparities. Here are my references, and thank you for watching.